In the wake of the COVID-19 pandemic, the importance of safeguarding personal health information, PHI, has become more apparent than ever. The pandemic has highlighted the critical need for robust protections around sensitive health data, reinforcing the importance of compliance with the Health Insurance Portability and Accountability Act, HIPAA. In this blog, we will try to find the key to success for HIPAA compliance. There are mainly four components for this, and when you achieve them, you could perhaps say you have found the key to success for HIPAA compliance. We are saying perhaps because there's always room for improvement. These four components are: understanding HIPAA compliance in detail, mapping the compliance with specific features you might need in a QMS, implementing the QMS, continuous improvement, analytics and tracking, audit and training. Let's jump into each of them in detail. To achieve HIPAA compliance, it is essential to understand the Act's core components and their subpoints. Here is a detailed breakdown of each HIPAA component and how Isolocity QMS addresses these requirements. The Privacy Rule establishes national standards for the protection of PHI. It applies to all forms of PHI, including electronic, paper, and oral communications. Key elements include patient rights. Patients have the right to access, amend, and obtain copies of their PHI. Use and disclosure. PHI can only be used or disclosed for treatment, payment, and healthcare operations unless authorized by the patient. Minimum necessary standard. Only the minimum necessary information should be disclosed to fulfill a request. The security rule focuses on protecting electronic PHI, ePHI, through specific administrative, physical, and technical safeguards. Administrative safeguards. Policies and procedures to manage the selection, development, implementation, and maintenance of security measures. Physical safeguards. Measures to protect electronic systems and related buildings and equipment from physical threats. Technical safeguards. Controls to protect ePHI and control access to it, including encryption, authentication, and audit controls. This rule standardizes electronic healthcare transactions and code sets to ensure consistency and efficiency. Standard transactions. Formats for electronic claims, eligibility inquiries, and other healthcare-related transactions. Code sets. Standard codes used to describe medical procedures, diagnoses, and drugs. The Identifier Standards Rule requires unique identifiers for various healthcare entities. National Provider Identifier, NPI Unique Identifier for healthcare providers. National Health Plan Identifier, HPID Unique Identifier for health plans. The Enforcement Rule outlines the procedures for investigating and penalizing HIPAA violations. Compliance Reviews. HHS may conduct compliance reviews and investigations. Penalties. Fines and penalties for noncompliance, including civil and criminal penalties. This rule mandates that covered entities notify individuals and authorities of breaches involving unsecured PHI. Notification requirements. Timely notification to affected individuals and the Department of Health and Human Services, HHS. Breach risk assessment. Assessing the risk of harm to individuals from a breach. Below is a table detailing how Isolocity QMS addresses each HIPAA component and its subpoints. Starting with the Privacy Rule, under Patient Rights and Access, Isolocity QMS provides a solution. It allows you to upload all protected health information, or PHI, in the document module and securely share it with patients. Additionally, use and disclosure is covered as well, allowing you to store and manage patients' consent within the same secure environment. However, for the minimum necessary standard, the system doesn't specifically address this. It's something that users need to ensure through proper discretion. Next, we move to the security rule. For administrative safeguards, Isolocity QMS provides all the necessary tools, including a risk management module, an audit module, change control, and more. You can even build your own processes and document them for training purposes. As for physical safeguards, this is only partially covered. While physical checks need to be done in person, the software can be used for equipment and activity inspections. For technical safeguards, Isolocity offers various encryption methods, including SSL/TLS encryption, and provides detailed audit trails to track changes made within the system. Moving on to the transactions and code sets rule, the QMS does not directly handle standard transactions or code sets, as it's not designed as a customer-facing platform. However, it can store relevant documents and facilitate employee training in these areas. When it comes to the Identifier Standards rule, Isolocity doesn't manage National Provider Identifier, NPI, or National Health Plan Identifier, HPID, directly. Healthcare providers must obtain and manage their NPIs, though the NPI can be included in document footers. HPID details can be added to patient records in Isolocity, but managing these identifiers is beyond the scope of the QMS itself. Next, for the enforcement rule, Isolocity QMS is fully equipped to handle compliance reviews with its dedicated audit module, which streamlines the process for easier review. However, penalties are handled outside the QMS and would involve external communication. Lastly, under the breach notification rule, Isolocity has strong security measures to prevent breaches, but if a breach is detected, the system can initiate a corrective and preventive action (HIPAA) process. Depending on the severity, the breach can be escalated to external parties, such as the Department of Health and Human Services. Breach risk assessment is also managed as part of the HIPAA process. This mind map can help you visualize the above table better. By this time, you already have, if not sound, basic understanding of HIPAA and how that translates into your QMS requirements, i.e. features. So in this section, we will discuss what an onboarding process would look like, and we will again take Isolocity QMS as an example. In case you are in the process of finding the right QMS, you might want to check out these 3 blogs. How to choose the best quality management software. 3 deciding factors for your pharmaceutical QMS. Best QMS evaluation tool, downloadable Excel-based. Let's think that you have finalized your quality management software, and in this case, we would like to think that's us. So the process would look like this. The onboarding process begins with an initial consultation to understand your organization's specific needs, workflows, and current compliance status. During this stage, our experts will assess how Isolocity can be best configured to align with your HIPAA compliance goals. Based on the assessment, our team will work closely with you to customize Isolocity QMS. This includes setting up modules, workflows, and document controls that meet HIPAA requirements. We ensure that the system is tailored to your organization's specific processes and security needs. If you're transitioning from another system or integrating with another system, our onboarding team will assist with integrating your existing data into Isolocity. This process is handled with the utmost care to maintain data integrity and security, ensuring that all PHI and related documents are properly imported into the system. Training is a key component of the onboarding process. We provide free training sessions for your team, covering everything from basic system navigation to advanced features. This ensures that all users are comfortable with the system and understand how to use it to maintain HIPAA compliance. Before going live, the system undergoes thorough testing to ensure that all configurations work as intended. This includes validating that all HIPAA-related workflows, document controls, and security measures are fully operational and effective. Once the system is tested and validated, it's time to go live. Our team provides support during the initial go-live phase to address any questions or issues that may arise. We remain available for ongoing free support, ensuring that your organization continues to use Isolocity QMS effectively for HIPAA compliance. The journey to HIPAA compliance doesn't end with the initial implementation of a QMS. Continuous improvement is critical to maintaining compliance and adapting to evolving regulatory requirements. Isolocity QMS is designed with powerful features that support ongoing improvement through analytics, tracking, audits, and training. Real-time data tracking. Monitor critical compliance metrics, such as the number of audit findings, HIPAA, corrective and preventive actions, completion rates, and user training progress. Customizable reports. Generate reports tailored to your organization's needs, making it easy to review compliance performance and share insights with stakeholders. Automated alerts. Receive notifications for potential compliance issues, such as overdue tasks or incomplete training, allowing you to address them promptly. Audit planning and scheduling. Easily schedule regular audits, ensuring that all aspects of HIPAA compliance are reviewed periodically. Audit trail. Maintain a comprehensive record of all audit activities, including findings, corrective actions, and follow-ups, which is crucial for demonstrating compliance. HIPAA integration. Link audit findings directly to HIPAA workflows, ensuring that any identified issues are promptly addressed and resolved. Training management. Organize and manage training programs, track attendance, and assess employee understanding of HIPAA requirements. Documented processes. Use Isolocity's document control features to create and maintain training materials, ensuring that all content is up-to-date and easily accessible. Learning analytics. Track training completion rates, monitor employee performance, and identify areas where additional training may be needed. Achieving HIPAA compliance involves a thorough understanding of its components, implementing a compliant quality management system, and committing to continuous improvement. Isolocity QMS provides comprehensive solutions to address each aspect of HIPAA, from protecting PHI to facilitating audits, training, and ongoing monitoring. With Isolocity, organizations can ensure they not only meet regulatory requirements, but also uphold the highest standards of data protection and patient privacy.